All right, today we are stepping right into the delivery room. We're going to demystify those critical, split-second decisions that medical teams have to make when things get intense during childbirth. And these aren't just wild guesses. We're talking about precise, evidence-based first steps. So let's break down how these teams are trained to handle these moments. And that's a question that, it hits hard. When an emergency suddenly pops up during childbirth, literally every single second counts. So how do these professionals navigate these incredibly high-pressure situations to make sure everything turns out okay for both mom and baby? And that really is the main idea for today. For every single potential crisis, there is a well-rehearsed, scientifically backed protocol. And these aren't just like good ideas. They're a step-by-step playbook, a hierarchy of actions, all designed to solve the problem as quickly and as safely as possible. So here's what we're going to cover. We're looking at three main challenges. First, what happens when the baby's path is blocked? Second, how do you protect that crucial lifeline between mother and baby? And third, how do you handle an emergency after the delivery? Then we'll wrap it all up with a big takeaway, the power of staying calm under pressure. Let's dive in. Okay, our first challenge is all about those moments when the baby's journey is, well, physically blocked. And these moments, they demand some seriously quick thinking and even quicker and correct physical action. So you've got this scenario. Medically, it's known as shoulder dystocia. It is a really serious complication, and believe me, the wrong move here can make things so much worse. So what's the first thing you're supposed to do? Now, this is where it gets really interesting, this whole idea of instinct versus protocol. Your gut instinct might be to push on the top of the stomach to, help push the baby out. But that's actually the worst thing you can do. It can jam the shoulder in even tighter. The correct first step is something called the McRoberts maneuver. And this is it's brilliant, really. It shows you how elegant these protocols are. It's a super simple, non-invasive move. Just by bringing the mother's thighs way up towards her abdomen, the entire geometry of the pelvis shifts just enough to free that trapped shoulder. It's like a perfect little puzzle of anatomy and physics working together. Here's another really common problem. The baby is kind of sunny side up, which makes it much harder to move down the birth canal. And just telling the mother to keep pushing for hours on end, it's exhausting and it's not getting you anywhere. So what's the move? Well, instead of just waiting around and hoping for the best, the right protocol is to take direct action. A trained doctor can actually go in and perform a manual rotation, literally turning the baby inside the birth canal into the correct position for delivery. And the crucial thing to understand here is that this one action fixes the root cause of the problem. It can take a stalled labor that was almost certainly headed for a C-section and turn it into a successful vaginal delivery. It helps avoid major surgery. It's a game changer. All right, let's move on to our second big challenge. This one focuses on that absolutely vital connection between mother and baby, the placenta and the umbilical cord. This term is a really important one to get. When you see the fetal heart rate monitor showing signs of distress, it's often a signal of this, uteroplacental insufficiency. Basically, it means the lifeline isn't quite working at 100%. Okay, so seeing that baby's heart rate dip on the monitor, that's a moment that gets everyone's attention. It's a huge signal that something needs to be done, like, right now. But what is that very first, most effective step? The dramatic kind of Hollywood instinct is to yell "stat C-section" and rush to the operating room. And look, that might be necessary down the line, but it is not the first step. The protocol calls for something much, much simpler. Just have the mother turn onto her left side. And here's the beautiful science behind why that works. When a woman is lying flat on her back, the weight of the uterus can actually squish a massive vein called the inferior vena cava. This reduces blood flow back to her heart, which in turn reduces blood flow to the placenta. A simple turn to the left takes that pressure right off, and often you'll see the baby's oxygen supply return to normal in just a few moments. Okay, this one sounds really scary, right? It's called a nuchal cord, and it's something a lot of parents worry about. And while it sounds terrifying, it's actually pretty common. But how it's handled is absolutely critical. The absolute wrong instinct here is to use force. You do not want to just pull or yank on that cord. That is incredibly dangerous. You could cause all sorts of catastrophic damage. The right protocol is a gentle, careful approach. Simply try to slip the loop of the cord up and over the baby's head. The whole idea here is finesse over force. That umbilical cord is the baby's literal lifeline, and you have to protect its integrity. Calm, gentle management is always the way to go. Now for our final challenge. So, the baby's here, born safely, everyone's relieved, but the danger isn't necessarily over yet. The moments right after delivery can bring their own life-threatening emergencies. This is the #1 cause of what's called postpartum hemorrhage. That's heavy bleeding after birth. It's an incredibly urgent situation where the body's natural stop bleeding mechanism just isn't kicking in.
The problem is something called uterine atony. See, after the placenta comes out, the uterus is supposed to clamp down hard, like making a fist. This is what squeezes all those open blood vessels shut. But when the uterus stays soft and boggy, that's atony, those vessels just keep on bleeding.
So, what do you do first? You might think you need to do something physical, like massaging the uterus. And that's a valid step, but it comes later. The very first line of defense is medication. Give intravenous oxytocin. And this is a perfect example of using medicine to help the body do what it's naturally supposed to do. Oxytocin is the same hormone that causes contractions during labor. Giving a dose right now sends a powerful signal to that uterus. Hey, time to do your job. Clamp down and stop this bleeding. So when you look at these 3 completely different challenges, what's the one thing they all have in common? It all comes down to calm, methodical action that is guided by solid evidence. You know, whether it's a simple change in position like the McRoberts maneuver, or turning the mom to her left side, or giving a life-saving drug like oxytocin. The theme is always the same. Modern obstetrics is really built on this foundation of protocols that always prioritize the simplest, safest, and most effective action first. It's all about replacing panic with a plan. And that kind of leaves us with a final thought to chew on. We so often think of advanced medicine as, high-tech machines and complex surgeries. But as we just seen in some of the most high-stakes moments imaginable, the most powerful move is often the most basic one. It's really a testament to understanding the fundamentals and then having the skill and the calm to apply them when it matters most.